Ina alhamdulillah, wa salat wa salam ala wa rasulullah. I'd like to welcome everybody to our special series that we've been running here at Sunnahfollowers, which has gotten so many reviews, and I've attracted another audience of people. Seriously, Muslims and non-Muslims who would like to hear more about the human brain, because this is something that fascinates all of us. We recognize that there's different parts or different hemispheres of the brain, and as a result, and I see I got a couple of doctors here.
Uh-oh.
Yeah, you got one doctor from Twitch, no, Twitter. He says he's a brain doctor and he's enjoyed Dr. Brian something. I can't read your last name. Okay, but anyway, he's tuning in. We welcome you here, Dr. Brian. I can't read your last name well because it's so small. But once I start, stop talking and stream, I'll be able to put it up there and I can see. But mashallah, I welcome everybody here, the Muslims and the non-Muslims, to Dr. Daniel Abdurrahman McBride's series on the human brain and the different hemispheres of it and how we can improve the different sides of the brains and what they're connected to. We spoke about ADH last week, which Dr. Brian said what he enjoyed listening to. And also we spoke about dyslexia. So with no further ado, I'm going to turn it over to Dr. McBride and we can continue discussion. And Dr. Brian, I'll put your name on the screen and I'll type it up there so Dr. McBride can address you, see if he might know you. Okay, so with no further ado, I'm going to turn it over to Dr. McBride, inshallah.
Thank you. Assalamu alaikum, everyone. Last week and the week before, I'm a big fan of hemisphericity. We talked about hemisphericity. I'm trained in the Malillo method. I would recommend, again, my go-to source when we talk about brain function is Dr. Robert Malillo out of New York. He's not only is he a DC, a chiropractor, but he is PhDs. His most recent book, he wrote for families that can't get to him or to one of us that are trained in his method. And it's called Disconnected Kids. I think this is the third edition, and it's a go-to manual. It is the go-to manual to deal with, for example, ADHD is a great term to describe, to get a general picture of the way I think and the way I approach my brain care, even with brain trauma, my stroke patients, my motorcycle accident patients, car accidents, athletes. The idea is that if we go back to the term or the letters ADHD, we've got attention deficit and hyperactive. As we talked about a couple weeks ago, when I talk about attention, when we talk about attention deficit, we're referencing more, say, a right hemisphere in terms of its ability to inhibit distraction. Okay, it inhibits, if I can speak in very general terms, we're going to say the right side is going to inhibit looking around in class for the child. The right side is going to inhibit the outbursts. I've got a question right now. The right side is going to inhibit those distractions. So if the right side isn't as strong as the left, then the initiation side, the left side, the initiation, it may become overwhelming for the child and they want to initiate everything. They may not be able to control their outbursts, to keep to themselves, to wait till the teacher's done talking. They may burst out with an answer right away rather than waiting for the teacher to end the question. They anticipate, they initiate. So there's ADHD. With that in mind, what we want to do is not look at it so much as a genetic disorder or a disability. I know the label disability gets a lot of funding, and I understand that. But the idea is, think about what's taking place here. If I'm over initiating, I'm actually demonstrating a strength on that side. So what I want to do is, when I'm dealing with something, a very basic ADHD, and we went through the types, type 1, 2, 3, in a very general application, pretend it is just a lack of being able to inhibit outbursts. Keep it simple. All I want to do then is strengthen the right side. I don't want to dampen the strength, if that makes sense. What I want to do is ramp up the right side and get, if I can imagine, a lot of times the left side, they have outbursts. They're verbal. They're very focused attention, like right here, right now. When it gets real extreme, you try to take something from an autistic child, they're going to be upset because they're not done with it yet. Very, 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 very focused, immediate short-term goal. Achieve this, achieve this, achieve this. Play this game to the end. Play this game. Watch this video to the end. Watch it. They've got the short-term focus, but they don't have the long-term goal. Like, I may be able to focus on my teacher. They don't have the why, if that makes sense, or their why is very, very restricted. So they don't inhibit the initiation of everything. So what we want to do, imagine if they've got these gigantic verbal skills, and say they're super verbal, they're reading it at the age of 1, and they're blah, 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 and like this kind of behavior. Imagine if I could get, maybe they test out at 130, 140 on the left, their verbal skills. They actually test out at almost genius level. Imagine if I can ramp up a 70 to 100, 110, 120. Imagine if we can ramp up their right brain skills, and there's a lot of overlap. Okay, so it's not like this only does verbal, because remember, this does verbal word find, this does definitions, this side does comprehension. What did the whole book mean? What did the whole story mean? What was the writer's goal? Why did they introduce this character? This is the big comprehension. This is the big picture. This is the details. So imagine if I can get the big picture as strong as the details. Imagine if I can ramp up a genius level verbal left, and I can ramp up the right side to literally work with that. Now I've got a super genius who really is very good at expressing themselves and understands everything, can get the big picture, can put things together. I mentioned it before, I think. Einstein, they consider him a right brain genius. He was considered, if we use the terms today, he was considered a special ed student growing up, but he turned out to be considered one of the smartest people we've ever known, right? So that's the hemisphericity stuff. Then we talked. Oh, okay. And so then we talked, last week we focused on ADHD and dyslexia. A lot of that was based on the questions were asked from the week before. Hugely important concept, because again, imagine now dyslexia. Would that be a strong right or a strong left? And again, if we're having trouble reading words, and there's a couple different reasons, but pretend it's just word definition, word finding, then we've got usually a weak left hemisphere, okay? And at that point, they're going to have a stronger right side, so they're going to be more, they listen, they want to comprehend. There may be some hard, if they lack reading skills, they may lack hearing skills, and that could influence dyslexia also, because then even though they see the letter, if they've got hearing disruptions, like I said, there's a variety of causes for dyslexia. It's not just letter inversion and stuff. But imagine if they're having a weak left hemisphere, they're not good at word finding, they're not good at defining the word, they're not good at really getting the word part of it, okay, and the structure of it. But they're real strong on the right. So they enjoy listening to the teacher. They enjoy having things explained to them, and then they've got the big picture. So now what would I do? We'd want to train the left hemisphere a little and ramp that up. And there's a variety of ways to do that. We talked a little bit about, we use cold lasers. We use class 3. cold lasers. That way nothing gets warm. We're trying to provide, there are cells in our bodies that are chromophores and chromatophores, whatever research you're looking at. They're light sensitive, and they help the cells, they help create more ATP through light energy. And that light energy turned into ATP allows the cells to do more of what that cell is trying to do. You see it with exercise all the time. They've got the Amazon is going crazy with different red lights. Remember, those are LEDs. They're a little different. Some of them are good. They just don't have the level of intensity, so you're going to have to sit under them for longer than what the therapy we use in the office. But they work, some of them. The idea is we use light therapy, we use sound. Today, we're going to talk about the 12 cranial nerves. Just to be clear, though, the first two aren't truly cranial nerves, but they're labeled cranial nerves, and we'll talk about that. Different ways like taste, sensation. If we can get more light into, like I said, with athletes, if we can get more light into that, imagine along with stimulating taste, stimulating sound, and we're trying to light something up with a cold laser. All these stimulations force those cells to do more, and then the therapies, the cold laser we use, then provides more energy for that, so that the cells can heal, they can grow, they can make their connections. I mean, every time, a clean example in our office, I use it all the time with my patients. Oh, how can I get my brain better? Will it really work? Oh my God, they've got all these depressing, they've had all this depressing news, and they're worried about, I'm old, I can't grow any new cells, I can't do this, I can't do that. Remember, when I talk to a patient, I'll remind them, before you started coming to this office, you didn't even know how to get here. So your brain, as simple as that explanation is, picture it. You didn't even know how to get to the office. Now you're negotiating the traffic. It's wintertime down here, so we've got even more traffic. And the patients have learned 40, 30, 20, 70 years, 80 years old. They've learned something new. The brain made new connections. And like I said, with all the other stimulations we provide in the office, your brain is always learning new stuff. So don't take it for granted. Just because we age, we can't learn. We can learn. And all we have to do, like I said, I say it all the time. You train it in, you train it out. We train a lot of stuff in. When we're working with patients, whether they're young kids or adults older than me, we're training in new things all the time. It really is. We're training in new patterns. We've got it, even just like I said with the exercise. You light up the body while you're doing stuff. It makes the muscles, they can create more ATP. The muscles can do more, light up the whole room. That way the patient has all of this coming in. Like I said, with red light, the contraindications we do keep, though, or we're very aware of, is pregnancy, because you don't want to disrupt any growth rates, and cancer, because we don't want to give a cancer cell any energy, any extra energy. But that was a couple weeks ago. My basis is hemisphericity with Dr. Robert Melillo. We talked about ADHD because that's a great example of, all it is a functional disconnect syndrome. The brains are supposed to be connected, they're disconnected, and the function is off. FDS, functional disconnect syndrome. I know it's simple the way I'm saying it, but most of this stuff can be trained out. I've seen it, I've done it, and I know other people that have also. Now, the reason we're talking about cranial nerves is we talked about brainstem last week. One of the brothers mentioned that a family member, I believe, had a brainstem injury and things are off. Now, I'm not going to address any individual injuries, but what I'd like to do is talk about different things you can consider when dealing with a brainstem and rehabilitation and everything. Remember, like I said, with functional disconnect syndrome, what can I do? What is also in that area, right? And with the brainstem, you've got 12 different cranial nerves. You've got 3 different areas in the brainstem. You've got the midbrain, you've got the pons, and you've got the medulla. So imagine if we have a brainstem injury, generally speaking, very generally speaking. Imagine you have an injury up here at the top of in the midbrain. Number one, you've got a top half and a bottom half. A lot of textbooks will say rostral, meaning towards the face or the upper side, and they'll say caudal, the bottom half, towards the bottom, right? So in the midbrain, I have a rostral and a caudal. In the pons, I have a rostral and a caudal. And in the medulla, in the medulla, I also have a rostral and a caudal. So if I've got a midbrain injury, let me go to the pons. If I've got a midbrain injury, I've got cranial nerves 5, 6, 7, and 8. Okay, so I've got 4 cranial nerves. Imagine if I have an injury on the top half of that, right up in here, if I can simplify it like that. Well, what's on the bottom half? Or maybe it's a right side or a left side, or maybe it's only affecting one cranial nerve in that area. Well, I still have 3 others, don't I? And if I have an injury in the midbrain part of it, why not use cranial nerves in the pons and the medulla to run through the midbrain portion? And like I said, the first 2 cranial nerves, olfactory and optic, are not truly cranial nerves. Olfactory or smell, olfaction. Smell actually, if I can say it this way, rhine meaning nose, or rhinoceros, for example, right nose. The rhinencephalon, the nose brain is back behind here. It's in the mid-temporal areas. That smell center grows brain tissue right to the front, if I can simplify it that way. So now it's not a cranial nerve, it's actually brain tissue. And that's why it's so important with COVID. When you lose your sense of smell, you got to realize that's, depending on whose research you're looking at, that can be a 10-year window to let you know that something's going on in there. And then what we do is we ramp up the training, we work on your memory centers, we work on everything, strengthen the brain, what we call get more cortical. I just used the word a little while ago. Reserve, cortical reserve. So we build up more brain reserve, all this stuff. So imagine you got 10 years to strengthen it before you get a diagnosis of dementia. And some people talk about even 20, depending on other indicators. So think about where that rhinencephalon is, and that first cranial nerve is not truly a cranial nerve, but as I've mentioned before, the smell is just unbelievable as a tool. So powerful. It stimulates memories. You smell for holidays or whatever we're talking, like here in America, we've got as non-Muslims, the Christmas holidays, the the pies being baked, and you may smell something, or any of our immigrant brothers and sisters, you got these smells from back home, and you think about, literally, it stimulates a memory from another continent from decades ago in your grandmother's kitchen, or your mother or your father, or whatever took place. I'm all about smells and memories because I don't cook. I'm horrible at it. My kids, when we moved over here, the kids told my mother, don't ever buy dad another crock pot. So they don't have any wonderful memories of me cooking, but I have wonderful memories of my kids, my mother, that kind of thing, them cooking. But the idea is, think about what we can do with brain stuff. And the second cranial nerve is the optic nerve. And that, again, isn't truly a cranial nerve, and the way it comes in and does things and goes all over the place. And as we talked about before, remember, even though your temples and your parietal lobes are considered other stuff like sound and spatial relationship and muscular control and all that stuff, really important to vision, aren't they? So again, if we have any visual issues, stimulate and strengthen these. Now let's get into the cranial nerves, and we'll talk about different testing. I actually brought my testing sheets with me so that I could go over them really precisely. The third cranial nerve is oculomotor. That's actually eyeball movement using the muscles of the eyes. Cranial nerve 3 handles everything except trochlear nerve. That does angular movement up and in. Down and in. Anyway, that does angular eye movement, and then abducens, cranial nerve number 6. That does abduction or lateral eye movement, but 3 does the other ones. Okay. So imagine what I'm going to do is to test that and to train it. Remember, most of these tests we have, if it shows a weakness or something else is weak, but that is strong, we can still use the test as training. With oculomotor, cranial nerve 3, in the midbrain, the top of the brainstem. Then remember, you've got the pons in the middle and then the medulla. So here we are in the midbrain at the very top of the brainstem. And I'm going to start with cranial nerve 3, oculomotor. What I do is I'm going to hold something, even your finger. You can do it yourselves. We talked about eye movements that I mentioned before that are really, really beneficial. In this case, I'm going to ask the patient to look at my finger, and I'm literally going to do just a figure H, because remember I mentioned superior oblique. This also tests abduction and cranial nerve 6. But I'm going to do horizontal movement, and then I'm going to do up and down. And this ties all of those muscles in except trochlear. All right. And that's cranial nerve 3. It also, believe it or not, it's really cool. Most people don't know this. Your eyes are opened and closed by 2 different muscles. Cranial nerve, 2 different cranial nerves. Cranial nerve 3 and cranial nerve 7. Facial. Yes. So literally, if in this case, I'll ask you, close your eyes, close them one at a time, because then it can also tell me a strength and a weakness. You should be able to blink one eye at a time. Some people can't. They cannot close. And then I say, like I said later on, another cranial nerve, open your eyes voluntarily and open one at a time, like I'm doing now. Some people can't do that. So then that's going to tell me, as part of my care plan, for example, if you can't open your left eye by itself, you have to use your right eyelid also, then I'm going to have you repeat that motion or that movement that you're lacking, and I'm going to stimulate, or one of the things we'll do is I'll laser that side of your brainstem, and you can either come in, well, the way we approach it, but I'd laser the left side through the mouth or right here behind the ear, angled up towards the brainstem. So you can look at these different things. Like I said, what else is, as in my initial example with the midbrain, if I've got a problem up here and I can't get these 2 cranial nerves to work, then why don't I go after it with other cranial nerves from the pons and the midbrain? Does that make sense? And then you can come at it from the top down also with voluntary control, because that's up here. The next one is trochlear. Like I said, with that, it's going to be eye movement down and in. The way it attaches is really cool. You can look up the Greek word or Latin word, whatever it is. Latin, I believe. So trochlear helps down and in. So then literally it's take the finger, and you can test, of course, one eye at a time is best, and then test them together. And then you're just going to watch the finger, and you're going to go down and in. And then my left eye down and in, and then there. And then you can also bring it in and do the nose touch. They should be able to see. I wear glasses, so it's not as easy, but sometimes I'll do my homework, and they should be able to see one finger. I want to use one finger, one thumb, all the way to within about 2 inches of their nose. And then when they start seeing 2 fingers, if it's farther away, if it's out here, then what you're going to do is train it. Does that make sense? A pencil, a pen, your thumb. And then you're going to try focus, get one finger, then bring it in a little closer. If it's 2, you stay on it till it's 1, stay on it till it's 1, stay on it till it's 1, and then you're normal. Does that make sense? So with that in mind, even in that area, now we're moving into cranial nerve 4, we're still working with the eyes, aren't we? So here we are doing eye movement. The other muscles are still slightly involved with this, even though I'm emphasizing the trochlear nerve. I'm still dealing with eye movement, initiation and inhibition. The medial rectus, as I do the trochlear, there's a muscle called the medial rectus that's going to help me move it in. Does that make sense? That's up above in cranial nerve 3. So when I'm dealing with a patient, what else is there? What feeds into it? Um, what part of the brain is it, right or left? Do I want them not to do something? Do I want them to do something? So it's one of these things. What else might be in the area, or what else assists with that? For example, I'll jump ahead. Cranial nerves 7, 9, and 10. And in a lot of research, we'll say 5, 7, 9, 10, and some include 11. All of these cross stimulate each other. And cranial nerve 5 is gigantic. It's called the trigeminal. It comes down out of the skull, down as far as your neck in terms of your second, maybe even as much as your third cervical vertebra, or the third bone in your neck. Imagine how big that cranial nerve is. So imagine if you can light up, and we'll talk about it next, cranial nerve 5, your trigeminal. This is really cool. General sensation to the face. Okay. And it breaks into what we call, meaning the Roman numeral 5. Okay. We're going to call it 5-1, 5-2, and 5-3. So imagine just that by itself. If I have a weakness in 5-3, I'm going to stimulate. Okay, it kind of like this. You got your ophthalmic branch, your maxillary branch, and your mandibular branch. So imagine if the mandibular you don't have any sensation here. Then I'm going to stimulate these other two up here, the upper ophthalmic and maxillary, stimulate those. There's going to be some feedback and some stimulation into the maxillary. Just that nerve by itself, we can cross-stimulate it. Now imagine it's huge. So now you've got cranial nerve 5, 7, facial, the motor. So now I've got 5 is facial sensation, 7 is facial motor control. Then I've got 9 and 10. 10, I'll jump right to that. 10 is the vagus nerve. Sympathetic, calm. You want a strong vagal nerve. It involves its swallowing, its digestion. Vagus, one of the main places right here, coming to the surface of the skin. That's why using a Q-tip just on the outer edge of the opening can ramp your system down. That's why we get all these, you see these things advertised all over the place for vagal nerve stimulation, and they clip them either here or deep here or here. This area is really good for stimulating the vagus nerve. But imagine now, like I said, 5, and think about, hopefully I'm not jumping around too much. Think about what I said. 1, 2, 3, and 4 are considered midbrain. 5, 6, 7, and 8 are pons. 9, 10, 11, and 12 are medulla. Imagine if I have a weak vagal nerve. I've got bad digestion. I'm very emotionally dominant. My emotions are all over the place. There's no calm. There's no vagus stimulation. And poor digestion can be reflective of that. One can cause the other, but they'll both make each other worse. Emotions can wreck your digestion. And of course, poor digestion is going to ramp you up too. And it probably is very emotionally related, believe it or not. Vagus nerve. So imagine I'm up here stimulating cranial nerve number 5. And like I said, it's gigantic. Facial sensations. There are times when I literally will ask a patient, listen, you've got to tolerate your husband or your wife stroking very gently, just light touch the face while you talk. Because 5 is so big, its influence on the nerves that it cross-stimulates, they cross-stimulate each other. Its stimulation at 5 cross-stimulates 10. And then imagine if you're doing something like that. I'm massaging and being a gentle talk and speak, and it's you got to tell them you got to tolerate it because it's good for you. And then imagine if you're just messing with the ears a little bit. Believe it or not, I have patients. If it's a child, we have to have the parent will try to train it in. It's stimulating vagus can be life-changing for some people, and it could be something. They can't handle the ear part, but they can handle stimulating 5. Then you want to stimulate 7, what we call muscles of mastication. Have the kids chew gum, believe it or not. Have the kids chew anything that's safe. Because 5, 7, 9, 10, and possibly 11 cross-stimulate each other. So think about what's taking place there. So now we want to ramp up vagus. So we stimulate 5, 7, and 10. 5, 7, and 9. And 9 is glossopharyngeal. Yes. Glossopharyngeal, swallowing, all that stuff. And vagus is important to that. So you want to stimulate vagus, rub your ears and swallow water. And talking, actually, deep breathing, stimulate diaphragm, massaging the organs. But that's cranial nerve 10, cross-stimulated by a gigantic cranial nerve 5. You can also do sharp and dull to the face on the V1, V2, and V3. I also check clenched jaws. We want, this is important with 5, believe it or not, does the mouth open in a straight line? Or does it deviate? Some people, if it goes off, think about where 5 and 7 come out right behind the TMJ. Normal, patient can stick 2 fingers in their mouth. Good 5, right? Pulse ox, again, cross-stimulating 5 and 10. 10 is very important to heart rate and respiration. I should be able to rub the eyes, facial sensation, and I should see a pulse drop between 6 and 10 points. Have the patient seated and make sure, but again, a contraindication, make sure they don't already have low blood pressure or they have any heart conditions that lowering their heart rate might be a problem. And I don't have to do all these tests. If something comes up like that, I just don't do that one. Blink reflex. They taught us in school, you can touch the eye with a piece of a cotton ball very gently. That reflex should be there. Then you can measure how quickly they both work to see if one side's weaker than the other. I use a little air poofer, the same thing, a little rubber ball that I got it to clear baby sinuses. I've never used it for that, if any patients are watching, but that's what I use. I poof air into the corner of the eye, and by the time I move to the other eye, they're already anticipating. So you've got a strong cranial nerve 5. And then the jaw tap if you want to. It's like the reflex when the doctor taps your knee or your forearm, your bicep, or your tricep. You can tap the jaw and you should get a little quiver. You've also got a tap right here, and you can tap that and the lips will pucker. And then cranial nerve 6, lateral rectus, or eyeball abduction, moving your eyes outside. So this one fires, and this is really cool because when I'm looking to the outside, this nerve fires, and there's a whole group of the way the fibers come together. And cranial nerve 6 also stimulates 3, as I mentioned earlier, to get the medial. This is lateral rectus or lateral eye movement. Then I need medial eye movement to go with it. So imagine if the left eye or the right eye, one eye can go all the way out, but the other eye only comes about halfway with the same movement. Now what am I going to do? I've got to find out whether it's cranial nerve 3 and the medial rectus showing weakness in movement, or is it 6, or is it 6 and that's not firing strong enough? And then you also want to, with eye movement, one of the great overrides is whether your cerebellum works or not, whether your cerebellum works smoothly. Very important to reading also, a smooth cerebellum, because if I can't get my eyes working in conjunction to each other, that's the cerebellum is hugely important for that. And again, now I want to improve eye movement, so I'm going to improve cerebellar movement, cerebellar function. And that could be balance training, smooth movement, coordinated movement. The cerebellum smooths out everything. I mentioned that before. It smooths out your thoughts. It smooths out your emotions. It smooths out your muscular function. It's balance. It's really training. Improving cerebellar work can actually improve eye movement and coordination work also. Now we're going to go to cranial nerve 7. And again, as I go through these, the overriding thought for all of us is, if 7 doesn't work, what's near it? 5, 6, and 8. If 7 doesn't work, for example, then how am I going to cross-stimulate that? I know 5, 7, 9, 10, and possibly 11 all help stimulate each other. So then maybe I'll work on 5, leave 7 alone, or I'll work on that with a couple of these tests. I'll stimulate 5, I'll stimulate 7, and then I'm going to stimulate 10. I'm going to really work on parasympathetic stimulation. You can massage the abdominal cavity because all of those organs are controlled for digestion by vagus. Hugely important. I massage I do it in the office with the patients, training their spouse or their parent, right? And it's just very gentle, but I do a lot of abdominal massage. Briefly, I demonstrate it a lot. That's how I should say it. I demonstrate it a lot or teach it, not as a massage therapist, but just as a stimulation to the abdomen. All I'm doing is rubbing a little bit over the entire abdominal cavity. I want the intestines involved. I want the stomach involved. You've got the pancreas a little bit. You've got a liver over here that's going to feel something. All those organs are influenced by the parasympathetic nerve vagus. So now imagine 7. I'm going to look at one of the things we do a lot in the office. I do a lot is I'm going to look at the lines in the face. Okay. I'm going to make sure all the wrinkles match. That way I know both sides of the cranial nerves that influence the face are strong and even. I'm going to look at the lines along the side of the face. They smile. Eventually, as we age, you create these creases, right? They should be pretty close. Some people, you'll see one side of the face is real smooth. The other side has lines in it. Well, that means, guess which one's the weak side, right? The one without the lines in it. That's not good tone. That means you didn't use it as much to create the wrinkles, if that makes sense. That's why these Botox smooth faces, you are anesthetizing these muscles, and they are numb and don't work anymore. So they can't move stuff. I'm not a big fan of that. So literally, I'll look at the face. I'll look at the lines right here next to the nose. I'll look at the smile lines. Everything else is hidden under the hair here. You'll look for wrinkles across the top, the wrinkles in the here, to see if one side shows more muscle activity than the other. Does that make sense? And then I'll ask them to make facial expressions. Smile. I want to see if they move equally. Frown. I want to see if they move equally. Raise up the eyebrows. See if they move equally. And then imagine if this works, then I'm also going to use 5, massaging it, 7, stimulating muscle action and chewing. Very important. And then this is the one, remember I talked about the cranial nerve that opens eyes. Cranial nerve 7 closes eyes. And I mentioned that earlier. But imagine now, voluntarily blink. I'm stimulating 7, right? Well, I'm bobbing my head too. That's kind of silly. Okay, so you're blinking. Close the right eye by itself. Close the left eye by itself. Train that stuff. Now you are literally strengthening, as simple as it may be, and it's probably not a lot, but you're working on where? You're working on the pons, because that's cranial nerve 7. Now that's going to influence the whole pons area. So now that's going to influence 5, 8, and 9, right? It has to. And then you've also got hearing. If you clench the jaw, cranial nerve 7 also influences the word, I can't pronounce it. I believe it's the one with the S, it's inside the ear. You clench your jaw, that should make you should influence that, and you can even hear better. Yes. So now you've got, and again, something as simple as gum chewing or chewing can influence cranial nerve 5, cranial nerve 7. It's also going to, because cranial nerve 6 is in there, right? 5, 6, 7, there's going to be some overlap. 5, 6, 7, and 8. I said 9. 5, 6, 7, and 8. All of those influence each other because they're in the same location. What's near it and what else does it do? And then we'll move on to number 8, hugely important nerve, vestibular cochlear. Not only is that the vestibular part is part of your balance, it's actually really important as your first real balance training. Vestibulo-ocular reflex. We talked about that, and we talked about the training for that to decrease dizziness. the vestibular ocular reflex, being able to separate eye movement from head movement. Focus your eyes while your head's moving while you walk or you drive, right? Or move your eyes while your head stays still to train it in. But this is my VOR. This is something you can do. I'll test with, I'll bring the head from the outside, I'll bring it in, and I'll bring it from up down and from down up. I don't like going away because as a chiropractor, a lot of my patients, they might come in with soreness and neck pain anyway. So I bring from outside in, but a lot of times just be tested inside out. Okay. They keep their eyes on me. Boop. And if their eyes follow their head with that movement and leave me, I know there's a problem and a weakness. And then we can talk about that another time. Then we also have friction rub. This is the hearing part. What we're going to do is this. And then you should hear it about out to 12 inches. There, I can still hear it. So I would consider that normal. Then I also want to do, did that go out the same? Did that go out the same? And I'm going to check both ears together and one ear at a time and measure those. And again, if one side's stronger, if one side's weaker, then we're going to work on that with sound training. And again, 5, 6, and 7, because that's cranial nerve 8. They're all in the ponds. I'm going to work them all. Train it in. Let's see. Cranial nerve 9, glossopharyngeal. Glossopharyngeal. Really important for tasting. And glossopharyngeal, meaning the mouth, the tongue, the pharynx, all that stuff. Bitter back 9 is the easiest thing to remember. You can taste, you have bitter taste buds all over, but they're really, it's sweet, salty, and sour tend to be up front and along the sides, and then bitter is in the back. Bitter is a really strong sensor because a lot of things that are toxic are bitter. So before you swallow it, it hits the back, and it's actually really cool. Research shows that the way we're designed, right? The way we're created. Imagine bitter is in the very back. Imagine some foods got past you. They weren't good for you. This bitterness is so bad and this food is so toxic. The back of your tongue and your throat are more likely to stimulate a retching and a vomit response than the front of your tongue, right? You spit it out, but something got back there and you're poisoned. It hits the back of your throat, and when your brain recognizes it as toxic, boom, it should come back up. So it's really cool how we're created that way with bitter in the back. And then the other test I would use is the ah test. In that case, I'm not looking at your tonsils. I'm actually looking at the soft palate, right? You put your tongue up, it's hard, the roof of your mouth. And then at the back half of it, it's considered a soft palate. That's under muscular control too, cranial nerve 9. What you're going to do here is take a tongue depressor, a spoon of whatever, and you don't have to go very far, and just and you want to look to see if the soft palate rises together. If one hangs lower than the other, what you'll see is what's called the uvula, that the thing that hangs down way in the back. If it swings this way, for example, that means this side lifted up and pulled it, this side didn't move. So now I know this side is strong, this side is weak, and I've got to work on, in my case, it would be on the right-hand side, and I'd be trying to stimulate that area of the brainstem, and I'd be doing other stuff like tasting bitter, and I might put it on that side of my tongue more, because most cranial nerves, all the cranial nerves except trochlear are ipsilateral. Okay, trochlear was the down and in one. All the cranial nerves come out ipsilateral, so they're handling that side of the face, the head, the neck, everything. Okay, so if it falls and swings and the uvula goes this way, then this side is weak, and I'm going to train that side. I'm going to laser that side. I'm going to bitter back 9 that side. I'm going to do other things for my left side of the brainstem. Cranial nerve 10, we already talked a lot about that because it's hugely important to darn near every aspect of our lives. Literally, that vagus nerve is everything they say about it. It's true. Every good thing. And then if it's weak, every bad thing, a lot of bad things can be attributed to the vagus nerve. The first thing we do is we do a lot of pulse ox. I want to see what the heart rate is, and we know the norms. Mine stays in the mid to high 60s. We want them to stay. They shouldn't be this 80, 90 and all this stuff. That's way too, what we'd say, sympathetic or way too elevated. You want to be down here. So I'll take a pulse ox and I'll do that. And then with the vagus nerve, I just want to know how high or how low it was. And I want to see how close to normal or lower it is. And that's what we're measuring at the same time. When we did cranial nerve 5 and the eye rub, I've got a pulse ox on them because I'm cross stimulating 10. And by the time I get to the heart rate part, I already know what's going. I have a good idea of what's going on because when I rub their eyes, I should see that fall. And I will rub for as long as a minute. If it doesn't fall within a minute, we've got a gigantic issue. And I know I'm going to be working with cranial nerve 10 down the road. All right. Let's see. The vagus nerve is also influential on the uvula. And then, so I'm going to stimulate 9 and 10. And again, like I said, 5 and 7 to cross stimulate all of it. Remember, I mentioned earlier, massaging the gut. I'm actually listening to gut sounds now. I just break it up into 4 quadrants. I don't do the 6. And I'll listen with a stethoscope and I'll listen for as long as 60 seconds. Whether you've eaten or not, I should hear gut sounds with a normal functioning vagus nerve. If I don't hear gut sounds within those 60 seconds in each area, then we've got an issue. And I know I'm going to have to work on the vagus nerve. And I can do that with the training, the ah sound. Let's see, what else do you do for vagus nerve is involved with the throat along with the glossopharyngeal. So you can gargle, you can hum and sing out loud. I recommend do that in the car by yourself because you might annoy your spouse or your loved ones. But all of these stimulate vagus. And then, like I said, right there next to the ear canal, some research shows all the soft tissue in the area in the tragus or the little ear triangle thing here. Now let's jump on to cranial nerve 11, spinal accessory. That's going to be your sternocleidomastoid and your upper trapezius muscles in particular, right? And you can stimulate those by using them, head rotation against resistance, right? You can stimulate them with touch. Be very careful because don't let my mother hear that. Your carotid sinuses are here, and you don't want to apply too much pressure. You can test for that. Apply pressure to the carotid sinus. The exact location leaves me right now. But you can put pressure on that and decrease the heart rate. You don't want to do that. Okay. So I don't do that test in my office. But certainly you're going to look at the level of the traps and the shoulders and see if they're level or not. If I've got an issue, then I've got to decide upper lower motor neuron issues, or is it just the cranial nerve, right? And then finally the hypoglossal, the easiest test out there. And the kids love doing this one, right and left. Hypoglossal, meaning under the tongue, hypoglossal. There's your test. If it deviates to one side or the other, which one's stronger? This one's stronger because it pushed it, right? And this one didn't push back. If this one's stronger, okay? So hypoglossal. There's all 12 cranial nerves. Then we get into, in the office, I do a lot of, remember we mentioned with ADHD and all that stuff, I do 10 primitive reflex tests. There's a lot. I have a poster on my 2 posters. One of them has probably 20 to 30 primitive reflexes. I test 10 of those. And we've got exercises Dr. Malillo put together that I use my patients, the parents. I teach them these exercises and they'll do those to get rid of the primitive reflexes, because after about the age of 1 and a little bit later for some of them, all of them should be gone. So if you're still demonstrating, even as an adult, I mentioned the story. I had a car accident, head trauma. And I checked his primitive reflexes, his rooting reflex. That's where you rub along the chin to the lip and from the cheek to the lip. And you want to hit both areas. And on the one side, he actually pooched like he was going to breastfeed, right? And that rooting reflex shouldn't be on an adult. So we had to do some brainstem work. And I gave him the exercise for that. And that's real simple. But we do check those because they are housed in the brainstem. So if those are baby reflexes and they are still there in an adult, imagine how big a problem that is going to be, because that interferes with what we call top-down control. That's bottom-up control. As our brains develop, and I mentioned it before, you've got the neural tube with the nervous tissue on the inside, brain pooches out everything, and your eyes tear away and pull muscles with them. That's why your eyes and your neck like to move together. As you get this bottom-up development, right, of the brain, you want then, as we age, you want top-down control. And if you still got control now, down here in the brainstem, those primitive reflexes are still active. They interfere with cranial nerve function. They interfere with brain function. You are not running at 100%. So that's why we check cranial nerves. We also check primitive reflexes, and that it's just hugely important. The brainstem, and as the brother mentioned before, brainstem injuries are hugely important to brain function. And think about, even if there were no cranial nerves, even if there's nothing else in there, it is the connection between your brain and your whole spinal cord. And then you've got tissue type changes and graduate. And if nothing else, you don't want to interfere with that funnel or that tunnel or that information coming up and out, right? I mean, if you've got primitive reflexes, if your cranial nerves aren't operating 100%, you know you have brainstem challenges, and we want to train it out. We want to find them and train it out. That's all with the brainstem and the cranial nerves. And I just mentioned the primitive reflexes. There's no sense naming them. Other doctors may use other primitive reflexes or include more, and I'm fine with that. I use the 10, and we have 10 exercises for that. Do we have any questions, sister? And then we do brain testing for the different lobes, frontal, and then, like I said, 5 subcortical areas. We do a lot of that also.
Issues that are located that has to do with the brain, and why is there some doctors that just want to deal with surface problems, and later on it turns out that it was more serious than they might have thought. It might have even started from infancy.
Yeah, it's really it's not even a criticism. If I use myself as an example, when I first graduated from chiropractic school, I was literally locked into the fact that I'm a chiropractor. No one else adjusts. No one else is trained to adjust as well as we are. When I say adjust, I mean move the vertebra safely and all that stuff. And there are good adjusters and bad adjusters. I would consider myself only average. I've had other people that adjust me that I know are better than me. I've had other people adjust me, and I'm like, oh, not going back there again. So it's that's how I was trained. Then that was 30 years ago. Now we weren't even using lasers back then, right? Now I have one personally that I carry with me, that I use at home. I use at the office. We have one that's left in the office. We have red light therapies. We have infrared saunas. So 30 years ago, we didn't even have that. So one of the things that can be a shortcoming with all of us, including myself, is I'm only doing what I've learned to do. I came across functional neurology. Dr. Michael Longyear introduced me to it up in Jacksonville. Phenomenal doctor. Oh my gosh, great guy too. Oh my gosh. And then Dr. Malillo. I've met them. I've had the chance to talk to both of them on multiple occasions. Phenomenal people. I visited Dr. Longyear's office. His wife works with him. Phenomenal people. We do what we learn. So you might have a neurologist that he knows how to test, he knows how to diagnose. He may be able to find things on the MRI and tell you what happened, tell you where it is, and then he sends you to someone who's trained in treating it. With particularly with chiropractors, I'm not allowed to use medication, so that's not an option. I can't ever consider that. And I'm not allowed to use sharp knives. My father was the chief surgeon of our hospital in my hometown, phenomenal, but I'm not a sharp knife guy either. So those are just not things that I can do. So I better figure out functions that I can test and treat, and that's what I learned. So we literally were in, and for example, Dr. Longyear does a lot of emotional work too with patients, he and his wife. I don't do a lot of emotional work other than the vagus, trying to get the brain to function better and controlling emotions that way from top down, and vagus influences. But he uses a technique that if you've got emotional issues, that can be treated by Dr. Longyear. He's the guy. And Dr. Malillo, he knows more, like this much more and more than I do. So we do what we're trained in, and I wouldn't want to criticize anybody else. They're probably really, really good at what they are trained in. And I don't go to a heart guy if I've got a gallbladder issue. If that makes sense.
Right, I understand that. That makes sense. That really makes sense. And it's so much just listening to you. There is so much that I'm learning or have learned about the brain. Is fascinating.
I mean, this is fun, isn't it? This is a good time.
Is.
Yeah, this is a good time.
Wow. The lobes and this. And
so where was you? Did you ever find out where that stroke took place or the strokes took place?
No, but I knew that one of the symptoms was I couldn't speak. I couldn't talk.
Well, that's a couple of different areas. That's a couple. If you had an MRI or something, and then like I said, what we've talked about before with it, wherever it is, that area does things. So you would do the things that are also in that area to strengthen up the area overall, if that makes sense. And then if it's on the right side or the left side, the simple thing is right side controls left body, left side controls right body. You do more with that side of the body, even to the point where you can play Quran in the one ear and it'll cross over. You can read with the book off center because vision crosses over. There's a lot of little things that you can do at home. But again, I'd advise you rely on really get the information from your trained professional. The neurologist you mentioned, make sure they get your PCP, your medical doctor's files so that the neurologist can make a really good educated decision.
That's what mine said. He wanted to get the files that my other doctor had so he could go over them and then get back to me. And then there are other people too that he may send you out to.
Yeah.
But they're puzzled. Some of them are puzzled, and some of them, they haven't seen it before. And so, Or maybe they're just going by what they heard. I don't know.
Yeah. It's really important for us as professionals to get all the paperwork, the previous files, because there's so much, and I'm a big fan of gathering information. I almost nag my patients with questions, and I'm all in their business. And then I like the files from the other offices. I want the other opinion. It's important to have everything we need, right? I mean, there can't be empty spots in my knowledge about your healthcare, because then I may miss something and you should have been somewhere else, or maybe I could have done more, and you paid me and I didn't do everything I should have done because I didn't know. Yeah, it's really important. You get that neurologist that information, and he'll probably do wonders. And if nothing else, like we say in our office, if it's beyond my scope, we'll know where to refer you based on everything we have. So
we have a question here too from one of the
Yes.
brothers. He says, does the cranial nerve affect the memory to the point where something happened and a person can't remember? He said, I'm the one that asked the question last week. He said, my brother, was found lying on the ground, and he was a normal person. He was taken to the hospital, and now he's doesn't know who he is or anything, and he doesn't even know what happened. He was struck in the head, in the back of the head, of the stem.
Mm-hmm.
And they thought he was dead stemmed, but he's in a wheelchair now and recovering. Will he ever know what happened to him to put him in this state?
That's tough, because that's there are so many moving parts in that, so many areas that could be involved. Just the head trauma by itself. It could be something as simple as a horrible concussion. He hit it, bounced, it hit it. It's just terrible head trauma. The brainstem part of it, we could have spinal trauma, and almost like even if the spinal cord is working, you got that shock that may have interfered with its function. I don't know enough to say whether he'll ever get it back or not. You also have, during severe trauma, and it sounds like this was a near-death experience, right?
Yes.
With the fact that he almost died, a lot of times your brain will shut down on the trauma, and it will remember the emotional part of it, but it won't remember the episodic part of it, the actual incident itself. If I can give you a silly example, you may, as a baby, your parents love circuses. And as a 1 year or 2 year old, you don't understand clown faces yet. Most babies do not enjoy circuses. So you go, the clown comes over, your parents got front row seat. They just know this is going to be the time of your life, and you're scared for like 2 hours. And the clown's always coming over trying to make you laugh, right? So you get more scared. Now you're 30, 40 years old. You're in your late 20s. You've never been to another circus. You don't like clowns. Are there clowns there? No, I'm not going. So imagine you don't remember that you went as a 2-year-old and never went again. But you're scared to death of these clowns. Your fiance, you're trying to make an impression. She loves circuses. You've been avoiding it for the whole relationship. Her parents want to go. She wants to go. You don't. But you're in love. You want to impress the mom and dad. You're taking them all to the circus because they love it. Think about how much stress you're having because of this emotional fear of clowns. Fear of clowns from childhood. You don't remember the incident, but the emotions are still there. Does that make sense? Your brain, 2 years old might be too young. Maybe it was 4 or 5. But it was so traumatic and so scary that you don't remember the incident. You just know you don't like it. Wow. This same thing could have happened during a physical trauma also. The trauma is so bad that the brain doesn't register that anymore, but it just knows it happened, and there may be some emotional um, ties to it if that scenario ever comes up again. It's similar to PTSD. There's no time frame to it, but there's emotions attached to it, and emotions are very strongly motivating. I mean, look at these guys that reelected the white guy. I mean, it's crazy that he got reelected, but he was able to really sit on emotions. He didn't. There's no context. There's no we'll do this, we'll do that. This makes sense. But he got a lot of emotional involvement, and that's the great override. So I don't know how to comment on whether he'll get things back or not. Where are you guys? Where is he rehabbing at? I might know someone up there that does a lot of neurology stuff.
He's in Ohio.
Okay. I'll try to see. Where in Ohio?
He's near where I live in Cleveland.
Oh, okay. Let me write down Cleveland FN. Brain trauma. Was it an assault or was it just a felon hurt himself?
Nobody knows.
Oh, wow. Okay. Okay. We'll see. Hopefully there's somebody out there that we could get him to. Because it's really, if he's, it literally is. It's so, neurology is so important.
And here's another question too. This sister wants to know, is it true when we see those videos on TikTok of some of the kids smoking crack and stuff, they roll around in the ground like they're possessed, but they say it's messed their brain up? Can something like drugs do that to the brain where it takes body and make you jerk and kids are in coma?
Oh, that's a lot of questions. I'm a big anti-drug guy. I'm anti-marijuana. I'm anti-alcohol. Actually, I don't drink. For Muslims, right? There's a reason for that. And from a religious perspective, Allah created us. Even the Quran tells us there's some good in wine, but there's more harm. If I'm paraphrasing it correctly. For example, alcohol. Too many drinks. It's a neurotoxin. Every time you take a drink, it kills nerve cells. It's a simple carbohydrate, makes you fat, wrecks your body. But in red wine, for example, the darker the better in terms of getting after something called oligoproanthocyanidin. That's cyanidin is cyan, the color, right? The dark blue, purple stuff. They now know how to pull that out. So there's the good without the alcohol. There's food supplements that have OPCs in them, great antioxidants. So there's some good, but more harm, because if you take it as a wine, it's an alcohol, horrible for you. But the if I'm saying it right, oligoproanthocyanidins are great antioxidants. They figured out how to get that out. It was a French guy, I believe his name is Mascalier, and it's called his formula, Mascalier's formula. Great antioxidants. So imagine alcohol on steroids. This crack stuff, this, as I mentioned, marijuana earlier, there's a lot of research showing that it rewires the pain pathways so that when you're not high, you're more sensitive to pain. So now people say, oh, but it helps with my pain. Well, you got to be high all the time because it's messing with your pain pathways. Those cannabinoid receptors, right? Cannabinoid receptors in our bodies are not designed to be stimulated all day, every day. No receptor is. Now we jump even to worse stuff with these other drugs, like you mentioned, the crack and stuff. Man, think about how much stimulation that is and how the brain is going to react to that. Yeah, these kids are big kids and adults could be falling all over themselves with that stuff, because when you take these drugs in, something as simple as alcohol, when you take these drugs in, it changes the way things function. And if you do it on a regular basis, you're rewiring yourself in such a negative way. You got to have a negative cascade of events, reactions, developments. You're wrecking yourself. You really are. I can't say enough about not even drinking wine. You want the antioxidants, look at food supplements for Mascalier's formula, or they'll say OPCs, or the full word is oligoproanthocyanidins. But man, you got to stay off those drugs. And then some human beings are wired for addiction. And that's usually what we call aberrant, or we'll say poor, bad habit formation. And that's usually a left side leg obsessive compulsive behavior, or obsessive behavior, obsessive thoughts, that whole OCD, tics, hyper on the left. So those things, if you're wired for that, you don't even want to try it. You know what I'm saying? I grew up back when Len Bias graduated from Maryland, and the night he got drafted #1 by the Boston Celtics while Larry Bird was still there, and that whole squad, imagine playing with that kind of team, and you're the #1 draft choice. And even Larry Bird said he was excited and he'd stay another year if they pick up Bias. And he died that night because of an overdose of cocaine, overdose of cocaine. So you don't know how you're wired until you do that stuff. And I just did not find out.
Wow.
My kids, all that stuff. I mean,
wow.
I better not find out.
Parents need to hear that so they can emphasize that.
True. I haven't seen any. I don't even have a TikTok account unless my kids created one for me. But yeah, that could very well be true. You start interfering with brain function, you don't know what you're going to get.
Wow. That's a lecture in and of itself, guys.
Oh my God, it's so scary. You can't, like I said, even the marijuana thing, I'm not a fan of legalization, strictly because, again, that starts rewiring your brain. And now they're looking at long-term use and all these research things. And
that would be a great topic, a suggestion for me, because believe it or not, we have a lot of Muslims right here listening to us who take that medical marijuana crap.
Yeah, I'm not a fan of that.
Yeah, that would be a great discussion, that you could do for us, because a lot of these Muslims do not understand that, like the Prophet said, there is no cure in anything that Allah made haram. And that marijuana is not helping you, it's just keeping you high. And It's making you worse. You might want to do a special, because you'd be surprised how many Muslims here in America are smoking weed, and they claim it's doctor prescribed. In fact, we have a fatwa, a famous personality.
I'm not a fan of that. That rewiring of the brain is not a good thing. It's but again, there's so many emotional ties to some subjects that it's that I don't even talk about it, in the sense that if I'm asked, I give my opinion. It's literally it's because I know some research and but if you're not going to believe me, if you're using it, all I can say is I know better. And I don't. Just like coming to Islam, I wanted to my motivation was to find the best way to get to heaven, because as a Catholic, I believed in it. I believed in an all-powerful God, and I want the best way to get to heaven, and this is it. And then the same thing with I look at research, I look at brain stuff. Yes, there's things that encourage. I take a lot of supplements. I do. Well, you can see some of the things on the shelf behind me. Herbs that don't disrupt function. A lot of antioxidants, anti-inflammatories. The food supplements I take. It's really, but I don't mess with drugs. I can't. The worst drug I take is caffeine, because. And I don't even like the flavor of coffee, but I do a cup a day usually. because of the positive effects it can have on diabetes, and I don't ever want to get that. The positive effects it can have on the brain. There is some research showing that it may decrease fluid content, but I haven't seen that research supported yet. Fluid content in the brain, but I haven't seen that research supported yet. It's really so that's about as deep as I get into drugs. And I understand there's medications and drugs that a lot of you need. And I'm cool with that.
This sister
But
here,
medical marijuana is not one of them. You do not need to be getting high all day every day.
this sister
That's
here
just the way
just
it is.
typed. She said it helps my migraine headaches. And
There's a lot of stuff that
she
all
said,
migraines.
I am not ashamed to say it. It helps
I'm cool
my
with that.
migraine headaches.
What is the cause of the migraines, though? There's a cause. What's the cause? And I doubt it's marijuana deficiency. That sounded sarcastic. I apologize. I didn't mean to be sarcastic. What I'm saying is there's a cause. Like if as silly as this is going to sound, if I keep banging my toe all the time and aspirin makes the pain go away, do I stay on aspirin? No, I stop banging my toe. When I had to replace both my knees because of college sports stuff. I replaced them a few years ago. I stayed with these knees, and I found that I was more pain-free when I exercised. I exercised right up to the day before I went in for surgery. And the arthritic stuff, and we can say whatever. If you saw the picture, you know what it was. But as long as I exercised, it kept my pain to a minimum, to the point where when I got to the point in my 60s where the pain was not kept to a minimum anymore, I had it repaired. Now all the arthritic stuff's gone and blah, 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 and things gone. So if you know the cause, like in my case, I knew the cause, right? And I mediated it. You have to figure out system. There's something going on that you get migraines. And I've dealt with migraines with everything from hydration to adjustments because if your curve has changed, now you've got a anterior neck posture, head posture, huge migraine cause. If there's something else going on, mineral imbalance, all that stuff. Maybe you got a low level food sensitivity that you're not aware of. You could have food allergies you're not aware of. There's so many little things that I'd recommend ruling all of those out first, or make sure they're all completely gone. Then next step, because like I said, the medical marijuana stuff is rewiring your system to feel more pain when you're not high. So that's not an encouragement to be high all the time, but the idea is it's actually worsening the condition so that it self-propagates and makes itself necessary to have, if that makes sense. So it's not a criticism, it's just the idea that I'd rather do a whole bunch of other things so that you don't need anything at all and you can live a happy, healthy life, if that makes sense. Sister Geechee.
Yes.
Question.
I have one after her.
Okay. Is it typed in?
Is Geechee there?
She just typed, I have a question.
Okay, go ahead, Geechee. Go ahead.
Assalamualaikum. Okay, I have two questions that I wrote down.
But you sound a lot different than your words typed out, okay?
No, okay. I have two questions. Number one, this was from last week. Okay, as far as the supplements, there are two supplements. I think it's thiamine and L-theanine, especially for the ADHD.
Mm-hmm.
How does that react? Because the current moment, there's medication involved. I have to put that in there.
Yeah.
But the L-theanine and the thiamine, I know that it's an active ingredient in green tea for calming. And,
Thiamine's a B vitamin. B is great for the nervous system. All of them. B 1 through 12.
Okay.
It's that's huge. The L-theanine, I have to look that up because I can't remember it off the top of my head, but I was just looking at something about that. I'm glad you said that because that's a supplement that has come up in my my Google News feed. It comes up in Instagram, I've looked at it before, but I can't comment on it right now because I can't remember. But I remember it in a positive light. I can say that. Yeah.
Okay, and I got one more question. Dealing with arthritic conditions like lower back pain, joint pain. I know there's a lot of talk about curcumin or what? Curcumin. I've tried that. It doesn't seem to work. And also anti-inflammatory diets. Also, in addition to that, they say, stay away from nightshade vegetables.
Yeah, it's supposed to be inflammatory.
Yeah, like, the tomatoes, the peppers, which is like the favorites for me.
Yeah.
What else can one incorporate overall, for, flare-ups of inflammation? Because as you know, inflammation really dampers a lot of things in your thinking, your body's function, and everything.
Yeah.
So, what would you suggest as far as in that position, as far as, taking alongside with other medications also that can help as far as being able to deal with pain,
Well, what's your cause? The thing is, what is causing the inflammation? An easy analogy or an easy way to see that is inflammation is not something by itself.
Mm-hmm.
Inflammation is usually caused by an irritation of some kind. With the lower back, I'll see on x-rays the neck, the lower back, whatever I'm looking at. If we have arthritic changes, you may have a bone in your lower back and off the bottom or the top or going back where the nerves, if this is the front of the bone, the nerves come out a little back behind it. If you've got arthritic development and bony shape changes here, the bone may be irritating the nerve, and no matter what supplements you take, because I use turmeric, which has got the curcumin in it. I use boswellia, which is great anti-inflammatory because they come at it from two different sides. So I use all those on a regular basis. But if you've got a constant irritation, it won't matter what you take. So I'm a big fan of turmeric. I'm a big fan of boswellia. I'm a big fan of antioxidants to dampen down inflammation because it's so bad. Especially if it's a constant joint inflammation, your body starts to get irritated with just that little bit, and you develop this systemic wide inflammation. Now you get into blood vessel, but you just don't need blood vessel inflammation because they swell in. Now you've got constricted blood vessels and you're in big trouble. It's really tough. I would recommend really cool. My go-to book for lower back pain as a chiropractor. My go-to book is something by Dr. Stuart McGill. He's a PhD out of Canada. The book I recommend and I teach from, actually in the office with patients, exercises. It's called The Back Mechanic. It's like The Back Mechanic. It's like $30. And when I talk about exercises, physical, like you asked a question about nutrition. Sitting on an anti-inflammatory diet, taking anti-inflammatories, great idea. That's what I would recommend. But if it's a physical cause, extra bone growth, irritation, some kind of arthritic kind of stenosis, making the opening smaller, you got Dr. McGill is a big proponent of finding pain-free postures. If it's not there all the time, then you can find pain-free postures, and then we exercise in those through the book. You exercise through those to make that range of motion and the movements broader, and you get rid of pain that way, if it makes sense. I would recommend, because I don't know what your x-rays look like, I don't know how to comment on the back pain. So I would recommend try Dr. McGill's book for $30-$40. You could go, I think the website is BackFit Pro, or you could type in Stuart McGill and the Back Mechanic and order his book. I gotta tell you, that's another one of my, like, Dr. Melillo for my neurology stuff, Dr. McGill for my pain stuff. These are books that are are active and on my bookshelf. When I have questions, I reference. So
Okay.
I'm sorry I can't give you a lot of suggestions on that, but I'll recommend the exercise book. And it's an easy read. It's big pictures, big explanations. It's just phenomenal book.
Okay, I have
Yes.
okay. I about that back pain. I had back pain all my life, and then I got into a car accident, and they did a pelvic pull, and that pain left. That pain left for a long time. It's come back now. So I'm thinking what I need is another pelvic pull. I just gotta
Describe.
find.
Yeah, describe that to me. What's a pelvic pull?
They put me on this table, and they pull something for a while, and then that pain just went away. That's all I know. So what is that?
It's probably, you would search up a doctor in your area that does decompression work. DECOMPRESSION. Decompression tables. It sounds like, because that pulls a while. It's long axis traction, decompression. You would want someone that does decompression work.
Okay, so would a chiropractor do that?
Oh yeah, lots of us. That's something. I worked for a doctor years ago when I lived over in Orlando, and he had two tables, and he had the decompression. It was really a big design, and you could separate the decompression in the lumbars from decompression in the cervical region, depending on where your issues were. Patients love that thing, but they have phenomenal doctor. He's a great guy, and he was very high end though. He bought the best and the most expensive, and he's a phenomenal doctor. So, but there are also less expensive things up in your area too. I'm sure you could look up a chiropractor. You could search up chiropractic and decompression if that's what you need. And if you
that's what I need for my back. Yes,
then
I
if you
need
find
that.
a good chiropractor, you can use that. I know exactly what you're talking about.
Yeah. Okay. And my other question was, you spoke about wired for addiction. What does that mean? I know that's the left side.
Usually, yeah.
More susceptible to being on drugs or something. So what does that mean? What do you mean when you say that?
I'll start with a big thing and narrow it down. We inherit our genes.
Mhm.
Then the environment turns them on or off.
Mhm.
Some people are very susceptible, very responsive, usually left hemisphere, are very receptive to drug stimulation. There's a lot of. Go ahead.
What does drug stimulation mean? Receptive
Well,
to?
it stimulates a response in your brain. You like it. And so a lot of people, a lot of research leans towards the dopamine. That's a hormone in your brain, another chemical. And dopamine is what your brain releases when you're pursuing something.
Okay.
And then there's also a pleasure response when you do the drugs. So some people are more susceptible. They have less inhibition, right? They have less self-control, and they're more wired to be more receptive to the sensations that the drug stimulates, that the drug causes, if that makes sense. Like something you may like vagus nerve stuff. If I can say that sensation, you see little kids, for example, man, you stimulate their vagus nerve while you're rubbing just the outside with Q-tips, their eyes almost roll back in their heads. I mean, I see patients, I'm stimulating the vagus nerve in the office, their eyes go to half-mast and their spouses make fun of them. So they are wired and they love that sensation. Imagine if it's a drug and it's probably even more powerful and more stimulating inside the brain. So that's what I mean, wired for addiction. Not addiction, addiction. They're just super responsive to everything that causes.
Everything that makes stay behind feel good, that's what you're talking about?
Probably.
All right.
Yeah.
Yeah, that's
Yeah.
why some of us have a low tolerance. Like myself, I can't take any narcotics. I can't take even Tylenol 3. I can't. My body can't handle it. I'll jump out the window. SubhanAllah. But then
Well,
again,
that's where that, like I said, I'm a big fan of turmeric. I'm a big fan of boswellia. Those are my go-to supplements for anti-inflammatory.
yeah, me too.
And
I just made
those
some.
are
I put
great
turmeric in
to deal
everything.
with inflammation part of pain, causing pain.
Yeah, I put turmeric in everything. SubhanAllah. Okay, any other questions or comments? Okay, the brother here is asking, are you going to continue this next week too? This is so
Well,
informative.
We're done with the brainstem. I mean, in the big picture scheme of things, what other brain related
The
topics
parents, the
would
mothers
you
here are
like
typing
to-
the drugs because this is a
I
big
have one.
this is a big problem with our Muslim
Oh no,
community.
she's doing later. I'll ask respond.
What happened?
No, you was talking. I said I will ask after you talk.
Oh, okay. I was just saying the sisters here, you can see they got teenage kids and
Yeah.
kids are in the drugs. The Muslim
Yeah.
kids are in the drugs. They saying that. Go ahead, Geechee. What did you suggest?
No, and you just said that. And one thing that I thought about is, like you were just touching on addiction. We got alcoholism,
Yes.
drug addiction. How does that, work within the brain? Because you just said there are more people that are more susceptible to it.
Yep.
And, they are finding markers genetically in regards to that there is a marker to that.
Yeah.
That's a very interesting topic. That's one, if you can, expound on.
Yeah, I'm sorry, I was rude. Go ahead. That was rude.
No, I just wanted the addiction and the pain. Those are two things that, I like to study on.
That's what the
Well,
people are
you
typing
decide.
too. They're all typing
what we
that
can do
too.
then is, let me see. Yeah, I know I can. Let me put together, mine again would be very hemispheric in its orientation. Okay.
Okay.
And I will discuss. I'll give you at least, I could probably come up with at least 45 minutes, if not an hour. And then we'll do questions and answers. And we'll talk about addictive behavior. We will discuss, we'll focus on addictions, because whether it's a food addiction, a weird sex addiction, alcohol addiction, a drug addiction, there's a lot of overlapping, not exact, but there's overlapping stimulus, reasons for that. And we could probably do that as addiction, and I can incorporate
Yes.
a little bit of everything with that.
One of the suggestions, one of the brothers here is suggesting.
One thing,
Wait a minute, hold on,
I
let
don't
me-
know if you brought
can they
this
hear
up
me?
before or
Oh.
not?
Wait a minute.
One thing is epilepsy, and I know there are different types of
Yes.
epilepsy.
So imagine a hyperstimulated physical child run themselves into the ground. I have 4 kids, very, very physical, outside all the time growing up. It was actually, for me, as an ex-phys ed teacher, right? That's how I started my career, as a helping phys ed teacher. It was fun having 4 enthusiastic kids, 2 boys, 2 girls. And now imagine they run themselves into the ground and crash, right? That's what kids do. Imagine your brain with an epileptic seizure, and there's a whole bunch of causes. It could be trauma, physical injury, it could be emotion, it could be changes inside, it could be chemical, it could be, there's so many different causes. Imagine the brain is supercharged and those cells are misfiring and stimulating each other. And they're like kids running all over the yard. These cells are firing all over inside your head. That's not my specialty. There's a lot involved with that. I make recommendations outside of myself for that. But imagine just a superficial answer. Man, you fire that epilepsy. That's misfiring all over the place. And it's just firing going. And then they fall out after that. Even if there's no physical seizures, they're firing inside. The brain gets exhausted and they go to sleep. They crash. So hopefully that's all that's taking place.
Oh, what about the epilepsy where like grandma seizures, where
again, you're getting a physical response to all that activity in the brain. It's demonstrated.
Yeah, because some babies have it, and neurologists do give medication.
Yes, absolutely. You do not want those things to go on for very long, because that cellular excitation, those little cells getting overexcited, they can use up all of their energy, they can use up all of their oxygen, and they can die cellular death. They can die by being overstimulated like that. So it's a huge concern.
Okay,
I know a girl, her mother died from the seizure.
Oh, I can believe it. Yeah, that's sad.
We have a suggestion here too. Yeah, that's a good idea, brother Amir. They were saying too, this since we're gonna stay on this topic, which is so good. He said, why don't you make it like we do the other class? Yeah, I see what you're saying, brother. Like we do Mother Muhammad Ziyada, do 30 minutes lecture and then 30 minutes questions.
Oh, I'm fine with that.
That way he said you don't, yeah, and that's right. And my mother typed that too. Yeah. 30 minutes questions and 30 minutes.
Are you being polite to me and saying I talk too much?
No. I'm just reading what they typing. And also, that's a good topic. This is from me now. So addiction.
I'll funnel it down to 30 minutes. And
let me write that down. You're going to do addictions. Addictions, all right? Because I'm going to get it.
I'll literally target 30 minutes, and
you can pick different addictions each week.
That information that I shared, that may fill in and create even more questions on your side.
Right.
Me, and we'll just go back and forth.
And you can do it different. And you can start. Geechee, can you put a jingle together? I'm thinking my mind is rolling now. We can do like sex addiction.
Are you pain with the addiction?
Wait a minute.
Let's do addiction first.
Wait a minute. Let's do addiction.
Okay.
And then we can break it off into pain addiction. That's 1 week. Then addiction to sex addiction another week. And he can talk about the different types of the brain that affect that.
I would recommend all the addictions. The way I'm going to reference addictions, they overlap like so much that the same areas, it'll be, to break them off won't really work.
That's not good. Okay, just keep them together. Okay.
But what we'll do is we'll do 30 minutes, and then we can focus in with questions and pursue it that way.
Okay.
Yeah, gambling. It's just so amazing how it all ties in to each other. Also,
okay, wait a minute. Here's another one.
Like ADHD.
Okay. There was a question from WANIY.
Wania.
Okay, y'all calm down.
I have a question about disassociation.
Yes.
So a long time ago, the majority of my life, I experienced some different traumas.
Yes.
And disassociation kind of like it. I would say it helped me.
Mm-hmm.
It kept me alive.
Yeah. Exactly.
But I feel like it's still affecting me. Is that possible? Like my memory? Like, is it possible for it to continue even though I'm not in those situations?
Remember earlier I mentioned that's tough. I mean, you're right, and it's tough to live with, because what you have to, you remember I mentioned a trauma, physical, chemical, or emotional. I don't care what the trauma is.
Mm-hmm.
I mean, I care, but those traumas, just the key, like you said, the key word is trauma. What happens is a lot of times your brain can't handle it. Physical, chemical, or emotional, it can't handle it. Like the brother with a physical trauma. The idea is that you may have, your brain remembers everything, but there's no reason to access something in your memory and to waste space on it, or episodic memory, meaning I can recall it now. There's no sense wasting time on it because you don't want to relive it, right? So what happens is your brain actively forgets, pushes it out so that you don't remember it. But there may be triggers like Vietnam vets or any vet surviving like a year of combat, and now they come home, and how do you get over that? You're worried all day every day about whether you're going to live or not, and a lot of traumas create those same feelings here at home. So you live with that. Your brain trains you to disassociate. Excuse me. Your brain, you train it in, like I said. Excuse me. You train this reaction in as self-defense and survival. Very right brain. Excuse me. Very right brain activity to forget. Okay. But there's still that emotional context, that emotional thing there. And what you have to do is figure out a way to, and I'm keeping it, I'm oversimplifying. So don't think I don't want to make it feel like it's unimportant. But if you can figure out a way with different kinds of therapies or whatever takes place, if you can move from the emotional response to the logical side, meaning, an example, one of my peers, he actually had a patient. She came in every time she heard a finger snap. Dr. Longyear, every time she heard a finger snap, she had seizures. That finger snap, believe it or not, was her trigger. So literally, this would trigger a seizure. She had trained in, she survived a car accident. It rolled over so many times. The driver died, she didn't. So the paramedic didn't want to shake her because it was such a physical trauma. You never know what's happening inside the body. So he's trying to wake her up. Her brain associated all those rollovers with the finger snap. She didn't know it. So like I said, Dr. Longyear does a lot of emotional stuff. They figured it out, and they trained out that response to the finger snap once they realized the emotional connection the finger snap had to the death and the near death for her. Does that make sense, sister? Does that apply?
I'm not sure.
Okay.
So I learned cognitive behavioral therapy for myself.
Yep.
And that has helped me to deal with a whole lot of things.
Yeah.
But it's like my memory is being, I've trained a lot of it out, but the problem is my memory has gotten really, really, really bad. And I was just wondering if that could be a part of the reason. Like I struggle with remembering different things.
Is it long-term memory or short-term memory? Or both, whatever.
I think it's both.
Okay, so repeat after me, but backwards. Just if you can give me just 5 minutes. Repeat after me, okay, sister?
Okay.
Say it out loud. Ready?
Ready.
Let's go. 8. Say it.
8. 8.
Let me write this down real quick.
I'm driving, so I
focus.
I can't write anything down.
No, you don't write anything down. This is your memory I'm testing. You ready?
Okay.
Okay, so the first number I gave you was 8. Okay, now I'm going to give you 8, 6. Repeat it backwards.
6, 8.
Okay, try to go faster next time. Ready? Now I'm going to give you 3 numbers. 8, 6, 6.
6, 6, 8.
8, 6, 6, 1.
81.
Okay, we've got a problem with your short-term memory. You should be able to get out to 5, most likely 7 numbers. You fell off at 4 numbers. And
Okay.
so what that tells me is it's probably more short-term, what we call working memory. Right now, it would be short-term working memory. So what I'd recommend is you could search it up, working memory and short-term memory. And then that's called, like, superficially, I just did a number recall. I just did a recall test. What you can do is you can even do those things yourself, like flip number cards, turn them upside down, and then turn them over, because now you're going to remember them backwards, right? So you could literally use a deck of cards, pick out like 7 cards, shuffle them up, or look at them, right? And you might get, just because I'll remember it, 1, 2, 3, 4, 5, 6, 7, like this. And then when I turn them over, boom, 7, 6, 5, 4, 3, 2, 1. Only we don't want them in that simple order. And what you do?
Oh, I understand now. Okay, I understand.
You look at it. That's the first card. That's the second card. That's the third card. That's the fourth card. And you will build up. First, you do 1 card and 2 cards. Then you do 1 card, 2 card, 3 cards, and then remember the numbers. Then you do 4 cards. Then you do 5 cards, and train in your short-term memory. Because what you have to do, the reason it's called working memory, is you had to remember the order I gave it to you, right? You had to remember the numbers I gave you. And working memory, now I'm making you give it to me backwards, so you have to remember the order and then give it back to me. Does that make sense?
Yes, it does.
So that's working memory. So let's start with just working memory for now, because long-term memory is a lot of stuff. A lot is more.
That kind of sounds like what I'm going through, because I had so many. I was having so many strokes.
Oh yeah. I'm sorry. Let me tell you, both of you or everyone, also use smells. Smells. Your rhinencephalon that I mentioned earlier, your nose brain, your smell centers, are right there in the same area as your hippocampus or your memory janitor. That's where the hippocampus puts everything somewhere, right? Somewhere.
That makes me say, I apologize.
No, go ahead. Say it.
It just made me think of, like, having this can kind of like cause issues in a relationship.
You don't remember your man's birthday, you're in trouble.
No, not that. Like, like just thinking about remembering like the right now and not like, the past and stuff like that. That just came to me. Like it can kind of mess up different areas.
It can mess up.
Not remembering certain things.
Now, where are you located? Did you tell me New Jersey?
Yeah, I did.
Okay. And I don't know anybody up there. Yeah.
I'm close. I'm like 5 minutes from PA.
Oh, gotcha. I grew up in Elmira, New York, which is just northwest of you guys. 5 minutes from Pennsylvania. That's tough. Like I said, Doctor, you know what you should do is you should reach out to Malillo's office and ask him if there's somebody near you, or reach out to Dr. Longyear's office. Like I said, he'd be the guy for you, Michael Longyear, but he's in Jacksonville, Florida. Plan your next vacation up by his office and work with he and his wife.
Thank you, brother.
I have a sister.
Absolutely. He's a phenomenal doctor, Dr. Longyear. But you can reach out to Dr. Malillo's wife and Dr. Malillo's office in New York and see if they can't find someone near you, because you've done so much already. Let one of us could push you over the top, if that makes sense, for the better.
Yeah.
We have a couple of people here on YouTube suggest when you do the topic on addiction, if you could include video game addiction. We got 3 sisters here who says that they're married and their husbands cannot stop playing video games. And also drug and food, or what we said, drug and food addiction. Yeah, so those are the topics: video addiction, drug addiction, food addiction.
Okay.
And sex, pornography. This sister says her husband hangs out in the basement, pornography.
That's tough. Then there's so much overlap. I can literally, we can umbrella that and make it a great conversation.
Okay, inshallah. Okay, guys. Well, alhamdulillah, this was a very good class.
Yeah.
I'm going to put these shorts out. You see why these shorts are getting so many hits. And inshallah, next week I'll make sure I put a thing out saying addiction. This will be the addiction topic.
Yes.
The brain, the human brain, and how it handles addictions.
That's a good title.
Yeah, that's what we'll make it. So inshallah, guys, we're gonna log off for now because we got Sheikh Saud at 8:30. I forgot about him. Yeah, thank God he's 8:30. At 8:30, Sheikh Saud. And then we have my class on the Mecca Siddiq Tafsir at 9:30. So may Allah bless everybody. Please log back in and at 8:30 for Sheikh Saud. Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Assalamu alaikum, everybody. This was really good, Dr.